I can't hear you.
There we go. How about that?
There we
Good
go.
morning,
Yeah.
everyone.
Good
Welcome to
morning.
Conversations with Cheryl. I'm your host, Cheryl Lacey Donovan, and we are here today to discuss the medical field and how the medical field has changed and or not changed during the scope of this pandemic. I know that everyone has their own personal reasons for why they do whatever they do in their practices or having to go out there into the pandemic every day. So we want to talk to each one of these individuals and find out how they're faring, how their practices may have stayed the same, or how they may have changed as a result of the pandemic that's going on right now. So we're going to start, first of all, by allowing each of our guests today to introduce themselves to you and tell you what it is that they do in the medical field. We'll start with Dr. Audrey LaCour. Dr. LaCour, welcome to Conversations with Cheryl.
Oh, thank you so much. It's so good to be here this morning. My name is Dr. Audrey LaCour, and I am in family medicine, and I own my own practice at LaCour Family Practice.
Awesome, awesome, awesome. Ms. Catrice Jones, tell us what you do in the medical field, ma'am. Oh, unmute yourself.
Hospital in the Woodlands in surgery, pre-anesthesia clinic surgery.
Okay, so pre-anesthesia clinic surgery in the Woodlands at a hospital, correct?
Memorial Hermann Hospital in the Woodlands.
All righty, thank you. Dr. Green, how about you?
Yeah, good morning, everyone. My name is Dr. Demetrius Green. I do have a general practice in the southwest part of Houston, where I do general medicine with emphasis on metabolic disorders, diabetes, high blood pressure, and heart disease.
Awesome. And Dr. Faith Foreman, how about you? Tell us a little bit about what you do. I just want to let y'all know I had to brag a little bit. These last two people are my classmates.
So good morning, everybody. I'm Dr. Faith Foreman Hayes, and I'm the Director of Chronic Disease, Health Education, and Wellness for the Houston Health Department. I'm a doctor of public health, and so I focus usually in chronic disease and wellness, but COVID-19 has redirected a lot of us.
Okay, awesome. That's great to know. I have another one of our guests that's trying to get on. Let's see, just need to click the link. I know that this is a different type of platform for everybody, and that's another thing that's changed a whole lot for all of us since the onset of the pandemic, and that is this whole technology piece, so everybody's trying to get used to it. I have another one of my classmates that's coming on with us now. I thought I'd get his perspective. He's only dentist on the broadcast this morning, Dr. Alan Emmerich. Hey, Alan, tell us about yourself and what you do.
Good morning to you all and to your viewers. I'm a general dentist in Sugar Land, Texas. Been practicing since 1994, and definitely we've been open during the pandemic and having to deal with all the different challenges with that.
Okay, awesome. And so we're going to just jump right on into that question, because I know that each practice has handled how they operate their facility differently. And you brought up a very interesting piece, and that is that some practices have chosen not to close their facilities as a result of the pandemic. And something else that I found also is because I work with students that are doing clinical rotations, medical students that do clinical rotations. And many of the facilities even had signs on the doors that said if you had a cough, you had a fever, if you had several different types of symptoms, that you were not allowed to come into that facility. You had to go somewhere else. And I thought that was very interesting as well to see. So Alan, since you brought it up, we'll start with you, and then I'll ask the other two doctors that are on the broadcast this morning the question as well. What went into your making the decision to keep your practice open?
Well, basically, the decision was, we have patients who are in emergency pain, who have they're suffering, they can't function, they need to have some type of treatment. So we wanted to facilitate that and being able to deal with it in the future, right? So you can postpone things, but there will be a time where you're going to have to make that decision on how am I going to function? How is the future going to be? So I'm like, well, let's do it now.
Mm-hmm.
So that's kind of like where our decision making came about. And of course, we were limited to only emergency type care, but it helped us carry over now to when everything has been lifted, that we still apply those same principles on how we treated and how we did our dentistry. Would remain the same, but we did modifications. One of the things that we, of course, I'm only one of 2 dentists in the Houston area that has a COVID, let's say a hazmat type suit. So patients are getting I have a respirator on, so they're not even having to worry about me, and I don't have to worry about them. And that's my new normal for Mr. COVID.
Okay.
So I said, welcome to my world. And so that's what I'm doing. And now my whole staff is going to have the same suit. Okay. And at first, everybody was rebellious. They're saying, you're going to scare the patients away. My staff was like, there's no way I'm going to wear that. My colleagues were like, you're crazy. This is insane. But it's actually been a blessing for me. And the reason why it's been a blessing is because I don't have to wear a towel over my head to try to breathe for 8 hours. That's the first thing. And also, when new types of viruses or pandemics are going to come along, who cares? I mean, I'll be ready for it. Ebola, Black Plague, whatever. It's going to come. And so we're going to be ready for that type of care that I'm not going to worry about. That's the least of my worries. And patients already have enough fear as it is coming in. I don't want to give them any more things to fear. And then the other thing that we're also doing that's a little bit different is we're using, and there's no scientific proof for this, but I am using a UV light, and I'm using that in my air conditioning system. So all the air that we're breathing is supposedly virus-free. Also in our home, we're using that. And I've got a hospital-grade UV light that's being used to disinfect my rooms, operatories, all the little keyboards and everything else that's out there. Because there's so many little things, it's impossible to clean everything. But that, if I want to encourage your audience, if any time, now is the time to go to the dentist. Why? Because we're just so much more cognizant of what's going on, and we don't know when they're going to shut us down. So that's another thing. Elective care, patients may say, hey, I want to get this work done, because in the future you may not have but emergency care.
Wow, that's a lot. That's a lot to have done. Dr. Green, I know you didn't close your practice either. So what thought process went into that, and what precautions are you taking with regards to having your patients come in? I know Alan is saying that he does the emergency care pretty much. That's pretty much all he does. But how about you?
Well, as a primary care physician, I'm on that front line. And with my practice, I decided that I can be a more effective physician if I continue to see patients in person. Let me give an example. Okay, I have patients with diabetes, okay, hypertension, heart disease. And of course, you need to do an actual physical exam. Now, of course, you can do, some Skype, but your exam and your assessment would be so much limited, when you try to do telemedicine or do medicine over the phone. With my practice, of course, I'm not a freestanding clinic, so I'm actually in an atrium building. So that's a 2+ in there. The fact is, in order for you to get into the building, you have to have protective equipment on. Well, not protective equipment, but you have to have a mask on. And of course, I do have a sign in front of my door saying that if you're having these symptoms, do not come in. You can actually call me from your vehicle in the parking lot. Also, I do have actually spaced out my exam room. So of course, I try to keep as much social distance as possible. And I do have what you call a screener. So when a patient comes in and signs in, the first thing they do is get a screening, and I ask them, are they having these particular symptoms? My staff looks over, and if there are any questions, and of course, I'll either isolate them or tell them they need to leave, and then give me a call.
Okay, all right. So our next guest, she opted to go to telemedicine, and that is definitely one of the options that is available. Dr. LaCour, if you'll go ahead and unmute yourself. All right. And I want to ask you, Dr. LaCour, because I know that had to be a very, very different for you, especially because of all of the various types of technology that are involved in trying to make that happen. So what was that transition like for you when you're talking about shutting down the clinic, and what thought processes did you go through in your decision to do it that way?
Well, first of all, my age had a play in it. And I too have some underlying health, concerns. and my staff is older, and my medical assistant was younger.
Mm.
So when the pandemic first hit, I asked my medical assistant, "Are you social distancing?" And
Mm.
she said no.
Wow.
So with that said, knowing the only person that knows what they do is oneself.
Mm-hmm.
And with my staff being older, I decided to close my clinic.
Mm-hmm.
And it has been interesting because, it's good that they have laxed the Texas Medical Board has laxed some of the strict guidelines that we follow for telemedicine. I decided that it was best for me to go that route because I know in the future that's where we're going.
Right.
And with the insurance is paying the same for face-to-face encounters as if I were in the clinic, I decided this is the way to go. I
Mm-hmm.
have found that with me staying at home and my staff being at the clinic, it has worked initially slow, but now since it's been about now 4 months to 5 months, patients are liking it because they're at home, they're comfortable, they're not waiting an hour to an hour and a half for a physician. They have my whole attention. I'm not worried about whether or not I'm bottlenecked, where the next patient is coming in, what if the medical assistant is being too slow, whether or not we're bottlenecked by getting labs. I can focus on the patient. There are some limitations, but if I can't do it, I actually have enlisted some of the family members. Do the back exams. I can tell if they're having problems breathing. I have actually enlisted some of their family members that are there to help with the exam. So it has worked out well for me. The most I run behind is probably 5-10 minutes, and the patients are at home, especially my elderly patients. They are so much more comfortable. They're not worried about whether or not they're going to get infected by the virus. Now, I do see on Fridays annual physicals, but I only see one every hour. And the person that cleans up the clinic is myself.
Okay.
So,
that.
yes. So I make sure that the beginning of the exam for the annual physicals, I ask them all the questions while they're in their car. So I control that pace. And then in the lobby, I am the one in my gear doing all their vitals, making sure that there's only one person in the clinic at a time. So if they have coronavirus, they didn't get it from the Cure Family Practice. Okay.
I hear you.
That's right. And so when they come back, I make sure that the exam room is open because there's only one patient. My staff, one member is in the front. And so I make sure that the air is circulated. I ask them not to talk. You see what I'm saying? Because, until they get back in the car. And if they have any questions, we can answer it from there. So that's what I've decided to do. So far, it has worked well. I will ease back into the clinic as I see the numbers improve. And if I can, verify that, confirm that my patients will continue to be safe.
Okay. So a new norm. Everybody has a new norm. Everybody is doing something a little bit differently than they were doing it before. And I really wanted to talk to someone that was doing the telemedicine because I know that when telemedicine first started being bandied about, a lot of people were very resistant. A lot of doctors were very resistant to telemedicine. They didn't really want to see into fruition, but now many of them don't have choice. Many of them have to use that telemedicine piece. So it was interesting to see how they sort of transitioned and switched and to talk to someone that's actually been through that and see how they've been able to deal with it through this pandemic. So that's an awesome thing to hear because I agree with you. I think that telemedicine, I don't even think it's the thing of the future. I think it's the thing now. I think telemedicine is going to become more and more of an option for people, especially if, with things that are more easily diagnosed. So I've done a couple of telemedicine visits myself, and I love it. I'm like your patient. I love it. If I don't have to go in, especially if I don't feel well, then that makes it a lot easier. I don't have to really get out of the bed. If I'm feeling sick, I can just get what I need and not have to be in a clinic with a lot of other people that are making them sick. So I think that's a good idea. So Patrice, I know you've been going in every day. We've been watching you sort of on the Facebook and praying for you as well because you're in that hospital setting and what have you. So unmute your mic and tell us what that's been like for you going in every day. And you're around a lot of people in that hospital. So what is that like?
It's tough. I will say it's tough. Being with Memorial Hermann Hospital in the Woodlands, we see tons of patients every day. In my department, what we do, we're prepping for patients that's actually having surgery, not necessarily patients that's coming in for or in relation to COVID-19, but these are patients that are already set to have surgery. And so what we're doing as we're prepping, the first thing is first surgeries are priority. We're limiting right now elective surgeries. As you've heard over the news, the airwaves or whatever, we're doing what's priority first. And so once those patients come in to be pre-op, the first thing that they're doing is they're getting a COVID-19 test. They're basically rapid. So we want to know early on if that patient is positive, who that patient have come in contact with. And if they are positive, when we find out, we're canceling those surgeries. Okay. No matter if it's urgent or whatever the case may be, because we don't want to put the surgery team at risk or doctors at risk operating on patients that's not necessarily urgent care, that's positive with COVID-19. And the next step is if they are positive, there's 2 additional COVID-19 tests that have to come back negative before we can even put them back on the surgery schedule. We're limiting our waiting room to patient only. We're not bringing them back. So if you have a caregiver, we're doing those appointments over the phone, but all patients have to be tested for COVID-19. From the perspective of the numbers are decreasing for us in this particular hospital just a little bit. But now we're seeing more children that's testing positive for COVID-19 because we see kids and adults as well. So the talk about it's not as prevalent for the kids, that is absolutely not true. We're seeing more and more children that's testing positive. And these are asymptomatic people that don't have symptoms, those that's not getting the fever. I know the series of questions, one of the questions was, are you experiencing fever? Well, a lot of people don't get fever. And so that's kind of a question that we're still asking those series of questions, but not limiting to that, and have you been around someone that has experienced symptoms, but maybe not be positive? Those are concern cases as well, because again, they can also be asymptomatic. And so we're encouraging people, even healthcare providers, us that's in the industry, to be extra careful, even with dealing with the patients, because we don't know if they're asymptomatic. They may not have symptoms today or may not be experiencing symptoms, a week from now. But we also go back and we review those positive cases, wanting to know, okay, who's come in contact with this particular patient when they've come into the office, and then getting ourselves tested as well on a regular basis, and not just doing the series of questions, but also getting tested ourselves. We're masking up. Our department, we're wearing 2 masks. We are wearing face shields and goggles just to protect, the staff as well. But I will say it's difficult. Only through prayer we'll be able to get out of this. We're praying for a vaccine. I know that tons of healthcare workers are working on that. So we're just in prayer right now that we can get a vaccine and get everybody vaccinated to stop the spread of COVID-19.
So I'm gonna ask the 2 doctors on the broadcast. What do you think about the COVID-19 itself? And you know what, Dr. Faith, you probably can answer. You could probably speak to this as well with regards to the spread, because what is interesting to me is how it has somehow transitioned, whereas in the beginning we were saying, oh, it's only older people. The older people are the ones that are really going to be stricken with the COVID-19. And now all of a sudden we're starting to see more children with it. Do any of you have any, maybe can speak to the fact of why you think that may be, or if something has changed, or maybe, because I don't know, because it seems very interesting to me that it's like it almost hits in pockets some kind of way.
Let me talk for a minute. Of course, you know, this is our third pandemic that we've had in the last 20 years. As you know, back
Mm-hmm.
in 2002, we had the SARS, okay? And of course,
Mm-hmm.
that was thought to be have originated in China. And then in 2012, we had the MERS, which is the Mediterranean, okay, severe respiratory viruses. And of course, you know, about 10 years later, so as you can see a trend, what's going on every 10 years, something's going along. Now, I'll get back to the base, and I don't want to belabor too much, but this is what you call a zoonosis, okay? Because when you look at the coronaviruses, that virus is actually normal flora for things such as bats, cats,
Mm-hmm.
dogs, okay, pigs, and certain other livestock. And of course, you know, in some of these countries, especially developing nations, we used to refer to as third world nations, you know, they eat a lot of what you call bush meat, or, you know, meat we not consider animal we don't consider as traditional. You know, like we eat cows and pigs over here, but over here, you know, they eat, you know, what you call wild animals that we would consider wild animals. So now you get these zoonoses, and of course, our system, you know, has to adjust and has to adapt to that virus. Now,
Mm-hmm.
we say about children, as you know, and we're in a society where, of course, you know, we have a pretty good healthcare system for those who can access it. And of course, with those children, as you know, they're getting their vaccines. Their vaccines are fresh. And as you get older, you tend to lose your immunity, you know, to certain vaccines you get. Not just taking that, you know, being not vaccinated, you know, it can make a difference. But as you get older, sometimes, you know, your immune system, you know, is not as strong as yours when you're young.
Okay. Okay. So you're thinking more so that it's an immunity issue more so than anything else.
I think so. I think
Okay.
so.
Okay, that's an excellent explanation because I really was concerned about that. And like you said, and I think Dr. Allen mentioned it earlier that it seems like, or we know that these things are going to continue to happen and that they may start to happen more frequently. So we have to be prepared for that. And I think this has been a huge wake up call for all of us to be in preparation. And, you know, some of the things that I'm seeing them talk about, you know, in my mind, I'm thinking you should have been doing that anyway. Like washing your hands, you should have been doing that anyway. Or, you know, cleaning your countertop, you should have been doing that anyway. So it's just interesting to me that something like this had to come about in order for us to really pay attention to things like hand washing and what have you. Alan, you look like you want to say something. Unmute your mic.
Oh, okay. Thank you. Can
There
you
you
hear
go,
me
I
now?
got you. I
Okay,
can,
great.
huh?
Well, I just wanted to respond to that. I just recently, yeah, actually yesterday, just heard of a Chinese doctor who's defected here, who has said that this coronavirus is genetically engineered. And what does that mean?
Mm.
That it is actually something that was man-made. It may have started with the bat, but they actually engineered it to do, you know, a lot more than we think. Now, why are there different symptoms? I agree with Dr. Green that it is due to your immunity. That's why you see differences. There's also mutations, I think, in this virus. So you may see one person getting different symptoms. I think it was I read about I guess maybe you might have heard of it. Iceland has a very good system, and they actually track and they can genetically code the virus. And they found like I don't know 4 maybe 5 different strains of it. And they can tell you this one came from China, this one came from the US, this one came from different areas. So to me, I focus, and I love about dentistry, is we focus on prevention. How do you build up your immune system? So that's where I think a lot of that comes into play. And and there's so many different controversial things. And as doctors, we have to be very careful that we can't say we know for sure that this medicine or even vaccines. And I personally have a problem with vaccines myself. I've taken vaccines and I can never seroconvert, which means I don't build up antibodies. So every time I've taken 9 series of vaccines for hepatitis, it never worked. So I have to find other natural nutritional ways to try to build up my own immune system to try to fight off infection. So and there's some things that are just common basic things like zinc, selenium, vitamin D, vitamin C. Those are good things to help build your immunity. Hydration, make sure you're drinking lots of water. And hot beverages, I think, are really good too. Not just cold beverages, but hot beverages. But this is not medical advice. This is not to say this is going to treat anything or diagnose or solve any problem. But I'm just saying basic common sense things.
One of our viewers has just said, thank you all for your service. They'll be sharing this. So this will be going on and people will be getting information from it. So Dr. Faith, I want to talk to you right now about, because you're on the forefront of the testing piece and the tracking piece. How effective have you guys been able to be with that? And what are you looking at right now as far as testing, like number, how many people are being tested, and things like that?
Well, of course, at the City of Houston, we have kind of a dual responsibility in the sense of from the time that the pandemic was acknowledged here in this country, we have had to kind of serve our community as a public health department. So we have responsibilities, clinics, we have dental clinics, we have health clinics, we have other services like WIC and senior services, TB services. So we had to try to maintain those services to the public, as well as we are the primary testers and we are the contact tracer for the entire city of Houston. So wow. We've had to do quite a lot. A lot of our staff was deployed and actually diverted from their normal duties. So if you were a nurse in one clinic, you now became the supervisor or the nurse that supervised testing out at Butler or Del Mar Stadium or at another location. So for us, it's been quite exhausting. And it has not stopped. It's been nonstop. We were running testing sites Monday through Sunday, so 7 days a week up until recently. I think it was around the Memorial Day mark, we were able to close on Sundays. The mayor allowed us to do that. So it is kind of for us continuing. We are initially, we were able to provide about 500 tests a day at our Del Mar and Butler sites. We increased that to 650 tests per day. We have been supported by the National Guard as well as CDC and some other federal support to complete testing. And then we were also able to begin partnering very early on with organizations like UMC and other, agencies and other organizations that were providing testing as well. So it kind of relieved some of the testing burden and fatigue off of the city of Houston because we got other organizations, other healthcare organizations, primary care providers, clinics, and other health serving organizations began to do testing. And so we have probably upward of at least 30 or more. We actually opened 2 additional testing sites at 2 churches last week. So the testing is continuing to broaden in the city of Houston and surrounding counties. And so we're thankful and grateful for that because more people can get a test. If you remember, initially, we were only testing people who were symptomatic, and we quickly pivoted that to testing anyone at our location. So you didn't have to have symptoms to come to a City of Houston location. You could be tested and you did not have to pay. And that is still the case. You do not have to pay. Our tests are free, and you should not be incurring any cost with our tests. So testing has increased in the city of Houston, and so we're happy about that. Now, what we're not happy about is we started out and we had a pretty good, I wouldn't say good because nothing is good in terms of positivity, but our positivity rates are a lot lower. Well, that's not the case anymore. We saw that our positivity rates went almost linear, just kind of straight up after we started to open up the city and the state rather. And so our numbers increased significantly once we started to open up more things, allow people to move around more. And so we're at a positivity rate of about 24 to 23% in the city of Houston. Yes, right now. And that's of people who test, who have taken the test. We have about a 24, and it was above 24. So the last 2 weeks, and we normally report those numbers every Monday in the mayor's press conference. So you can, if you're ever looking for the numbers or the maps or location zip codes, you can find that easily on any of our websites as well. So we're working really hard to get that number back down. The mayor has set a very ambitious goal of a 5% positivity rate. Of course, I was like, oh my gosh, when he said that, because I'm like, how are we going to do that? And try to do it rapidly, but we are working very hard to do it. You may have seen some of the stuff I've done the last 2 days on Better Together campaign that we've launched to get out into the community, to really educate people on the ground. We did some door-to-door canvassing in some of our high positive zip codes yesterday, where we actually went door to door. We didn't make contact with the resident. We used door hangers. And so many of the residents got these Better Together door hangers on their apartment complexes and their doorknobs. And with information, of course, we have Spanish, we have Vietnamese, we have about 6 different languages to really push forward 4 messages that we want them to do in their basic public health messages. And those are: wash your hands, wear a mask, social distance, and get tested if you need to. So that's really what we're trying to drive home at the health department and at the city, so that we can, keep people safe. And really what we want to do is empower the public, because anytime you are receiving mixed messages at different levels, so the federal level is telling you one thing, the state is doing another thing, and then at a local level, we're doing one thing. We really want to put the power back into the citizens' hands, and that is letting them know they can be empowered, stop the spread of COVID by doing those 4 simple things. And so that's what we're focusing on. We're still doing contact tracing. Contact tracing is very difficult. It is a hard job to do. It is mitigated and really regulated by how fast you get the test in. Testing was running slowly at first. So how quickly you can get the test, that means you can start your contact investigation once you have a positive, and try to get in contact with those people that the positive person was in contact with. And if you haven't gotten a test back in 15 days, by the time you begin your contact tracing, then those people have moved around and they've come in contact with others. So contact tracing is very, very, I would say, sophisticated. And we're still doing that. And we've brought on additional staff at the health department who are focusing only on contact tracing. So I hope I got all my stuff in and answered your question at the same time, because, as a public health person, it is important, for me to get a public health message out to the community.
So one of our viewers, and she hit it right on the head. That was Brenda. That was exactly the next thing that I was going to ask. She says, do any of your physicians or anyone on the panel have an opinion for kids, teachers, and staff returning back to school? How will it affect the city and surrounding areas? And that was a question that I had to. And Dr. Faith, you might be the one to kind of pose that to, because my first thought was, if you have a teacher that's in school and she has 5 classes, and we know those classes are never small, it might be 30 people in that class, you have 150 kids that she's come in contact with. So do all those kids get quarantined? Do they get, who pays for that test if they need to get tested? Then those kids have to go back home. Now their families are affected. So what do you think about that? And they're going back to school.
Right. So let me just kind of put the caveat there. I really believe the best folks to give us information on that are the teachers and the administrators and the superintendents, because they know their surroundings. They know, kind of just like we know what we do, they know what they do, and they know the likelihood and kind of what the milieu is. Okay. So that's the kind of, I think that should go there for teachers, administrators, and those that are the content experts in that field. But from a public health point of view, I'll give you something. I read an article, and like my classmate, I read an article this morning where there was a summer camp where out of 300 kids, they had about 200. I need to have the article in front of me, but 200 plus. Somebody can correct me on my exact number. I want to say it was like 247, but it was above 200 kids that tested positive after being at a summer camp. This is summer camp, right? Out of 300. So now all of those kids and their, direct contacts, if you're in the same household, will have to be quarantined for 14 days according to the CDC protocol. So if that doesn't answer the question, so that's just summer camp. So imagine going to a school. So I know that people want to return. We all want to return to some state of normalcy, and I believe it'll be a new normal. It will never go back to where it was at this point until we really get vaccine and we get things figured out. But as far as schools, I think just like all of the physicians on the panel have said, we're going to have to find a new way to work things out in terms of how we educate our children. We are the United States of America, and we are very good at doing a lot of things. So certainly we can figure out a way to do this without putting our children, our teachers, our parents, our families, and our communities in harm's way. So if kids go back to school, you can expect that there will be what we call community spread, because kids exchange. They, for example, will say, I think your mask is nicer than mine, so let's exchange masks. And how many of you have ever sent your child to school and he came back with a different coat? I'm like, that's not your coat. So, that's what's going to happen, because children are children. They're going to be kids. So I would say if we are in that situation where I know HISD announced last week, and I think Houston Community College also followed right behind them, and that they will not go back face-to-face for the first 6 weeks of school. I think that was a very wise decision.
Mm-hmm, mm-hmm. And so I hope other schools will follow. Right, exactly. We had a panel last week, as a matter of fact, where we talked about, a week before last, where we talked about that. It was teachers, administrators, and different people from different aspects. And those are the kinds of questions they asked as well. One of them was, if I am a teacher and I get the COVID or I'm exposed, that's 14 days. Do I even have 14 days allotted to me of time to even be off? And if I am, the extra time, are you going to pay me for that? So there are just a lot of questions right now that have not been answered. And I think that there needs to be some more thought put into it before we just arbitrarily send everyone back to school. And one more question for you. You brought it up, the CDC guidelines. What exactly are the CDC guidelines? A lot of people hear that bandied about, thrown around, but what are they? What do they look like?
Okay, so thank you, Cheryl. They're not mythical. They exist, and you can find them at the cdc.gov. I would recommend that people always follow credible sources of information, and CDC will provide you with a lot of what you need. They have an entire repository of information related to COVID and how to, COVID practices for schools, COVID practices for businesses, COVID practices for almost every discipline that you can find. And then they have, of course, your protocols for if you've tested positive yourself, what you should do, which is isolate 14 days, those kinds of things. They used to, initially, they came out with a guidance that said if you had tested positive, you had to retest. Well, they changed that last week. So you do not have to retest if you have tested positive, if you have isolated and you have been in your 14-day quarantine. So it's very wise to stay up to date, and CDC can give you those updates much better than I can, because they do change. So I will, and there are a lot of them. So I would direct any of our, viewers to go to cdc.gov and just, put in COVID protocols, or, what do I do if I tested positive? What do I do if my spouse or someone in my household tested positive? And they will tell you that, if you have a direct contact with someone that's tested positive, you should quarantine for 14 days also. You should get a test if you feel like if you have symptoms, of course, get a test. You can also get a test if you are asymptomatic. But CDC has done a good job with that. They have almost every protocol, probably for your dentist office, for your primary care provider. So everybody has a protocol. Too numerous for me to give you each detail, but certainly very, I think, well written in plain language where the average, reader could, make it out for themselves.
Mm-hmm. So I'm going to pivot back over to our doctors on the panel, doctors and the dentists. So we hear that word asymptomatic a lot. Why do you think it is, or do you have any type of explanation as to why we have some individuals that get all of the symptoms or various symptoms, and then there are some people that are walking around with it and they have no symptoms at all?
Once again, it has to go down, with, of course, your overall health, any other comorbidities. Do you have diabetes? immune disorders also can be due to, the Dr. Emmerich say, your nutritional status. As you know, when you're young, you get a cold, you can sneeze, you keep going on. Okay. Now, older, they get the cold and they get pneumonia, they can die while on an ventilator. And that's different like during flu season. The most people who are more vulnerable, during the flu season are what? Are you elderly and you're immune suppressed? So it has with, your overall health, okay, and your level of immunity. Just simple as that.
Okay. So, and what have you put in place, Dr. Green, in your facility with regards to sanitation practices and things like that? I know that all of the clinics, I'm pretty sure, have their own cleaning rituals and things like that. But now that the pandemic is here, has there been anything new or different that you've initiated as a result of that, or are you kind of doing the same things?
We've been doing the same thing, plus a little extra. Of course, I do have, sanitizer, not only in every room, bathroom, okay, throughout the clinic. So if anyone feels they need to wipe their hands, they can go ahead and do that.
Okay. And I know, Dr. LaCour, you said that you personally go in and clean up your facility to make sure that it's done correctly, I'm sure.
That's correct. I can tell you, I have gone even further. I actually open the door for my patients. I don't allow them to touch any of the surfaces.
Okay.
And so I open the door. They come in. I have one place for them to sit. I actually use a sleeve. Before I even use the blood pressure cuff, I do tell them everything has been sanitized. But this was one of the extra steps that I'm taking to make sure they feel comfortable. I make sure my stethoscope is also covered in plastic so they know that, my stethoscope is, has not touched anyone else except for them. And so all my vitals, like I said before, are taken in the lobby. I make sure they understand that I move it from one clean area to a dirty area. So they know that it doesn't go back. And so I too have hand sanitizer. I make sure that, again, that like I open the door for them and I make sure that one exam room is designated, for them to go into and make sure that everything is clean. I told my staff I'll probably get chemical pneumonitis from Clorox.
Okay. Catrice, are they doing anything differently at Memorial Hermann than what they were doing before? Again, of course, it's the hospital, so I'm sure they were doing quite a few things prior to this, but have they instituted anything different as a result of the pandemic? Unmute.
They've actually amped it up.
Okay.
Can you hear me?
Yeah, I can hear you now.
Can you hear me?
Mm-hmm.
Can you hear me? Okay. They've amped it up. To be honest, we've always, of course, used hand sanitizer, but it's more visible throughout the hospitals. There's more screening stations throughout the hospitals. We're using more gloves. You're seeing people with more gloves. Even the administrative staff have taken precautionary measures to jump on the clinical side of taking precautions with hand sanitizer, wiping down before and after each patient. Even with the things that we use for signatures, the signature pads, the hand scanners, all type of things we're wiping down. Some things have been discontinued because of less patient contact that we want to have. So it's definitely a step up. We now have the shields, even in the cafeterias for the workers in the cafeteria, the cashiers. When you walk into the hospitals, you'll see more plastic barriers. So just a number of things that we're doing differently to protect the patient first and foremost, but as well as the staff.
So it sounds like everybody has this. If nothing else, it's awakened everybody. It's made everybody much, much more aware of things like washing your hands. If you hadn't been doing it before, you're doing it now, and just keeping things neat and tidy and clean and sanitized. And hopefully, this is something that people will continue to do moving forward. Should have probably been doing it anyway. In my mind, that's what keeps coming to my mind. So I'm going to ask this question also because I said this earlier in the broadcast. A lot of the facilities that I've gone to, they have these little signs on their doors, and they say that if you have these various symptoms, you can't come here. Where do those people go if they can't come to the clinic?
That's where telemedicine come into play.
Gotcha.
I keep my doors locked at all time. I do have a sign on. I try to make sure that I can give my patients as much service as I can through telemedicine. If not, I can tell you that a lot of my patients call because they just want an order. They just want to know where to get a test. That has been difficult. So I'm glad that we have someone on the panel that can give them more direction. But at the same time, we also serve as a purpose in educating our patients because there's so much misinformation out there that I take the opportunity to teach them about the virus as much as I can. There's always changing information. Also, I've been telling them to teach, I can tell my patients about where their pulse, their oxygen level is, where's their baseline. So that if they do have coronavirus, I ask them to purchase a pulse oximeter and monitor their oxygen level and tell them exactly when they should try to make it to the hospital. Unfortunately, I have a patient who had to go 3 times.
Wow.
Okay. Unfortunately, he's young in his 40s. He actually has, he's had a heart attack before, diabetes, high blood pressure. He went, like I asked him to get evaluated for chest pain and shortness of breath. He was turned away twice.
Oh, wow.
Because he was told that his oxygen level, even though it started going down, from 96, 97% to 92, 90, they said it was too early.
Wow.
But remember what I said, and he kept going back. And at the time they allowed him to be evaluated, he was at 85%.
Wow.
So that's what we should be serving as a tool to educate our patients. And because some people, they don't know, they hear that chest pain and shortness of breath is part of the symptoms, but they don't know when to go to the emergency room to be evaluated. They are so afraid right now of coronavirus that, as they say, people are dying at home. And that's what I feel like we are all serving as a purpose, to keep as many people alive as we can.
Well, with that note, we're going to end it right there. That was excellent. Keeping as many people alive as we can. I want to thank all of you for joining me today for Conversations with Cheryl. And I love you other guys, but especially my classmates. I'm so excited about seeing them on here. This is awesome. So just thank you for joining me today. I think that we have done the community of service today. I know that there's many people that are watching today, and the information that you guys have shared has been phenomenal. And hopefully, like you said, it will get out there and the community will be empowered to take their healthcare in their own hands, to do some things for themselves so that they don't have to weigh down the healthcare system. There are some things that we can do to help get through this whole pandemic process. So again, thank you so much. I want to also thank my viewers for joining me here today for Conversations with Cheryl. You can see us here every Saturday at 11 a.m. Central Standard Time, 12 p.m. Eastern Standard Time. And we look forward to seeing you again on next week. It's been a pleasure. We'll see you next time.